So Vedika, good to connect with you.
I'm good to connect with you. I'm very nervous because it's my first interview.
Oh, don't be
No,
nervous.
not my first interview, but it's like
I
you're
know
very.
I've seen your YouTube interviews. You're doing very well.
Um,
I like your channel.
Thank you. I'm just like today. I'm like very like sleepy a bit, but I am just like nervous because you're like a well-renowned scientist, like
No,
other
you
people.
don't need to be nervous at all.
Yeah. So you are a very renowned scientist, and let can we just do a general talk and then we can start
Oh yeah, sure, of course, of course.
because
So
that kind of gets me to know you better.
maybe I will just introduce myself. So I'm Dr. Prem Pilay. I'm a neurosurgeon and clinical neuroscientist. I'm from Singapore, and I went to medical school at the National University of Singapore, which is now currently the number one medical school in Asia. It has been for many years. After medical school, I was working and training in the United Kingdom, and then subsequently in the United States at some famous hospitals. That includes the Cleveland Clinic in Cleveland, Ohio, MD Anderson Cancer Center, which is part of the University of Texas, and also at the University and Teaching Hospitals of the University of Toronto. Subsequent to that, I came back home to Singapore and I helped set up a brain center, which is now part of the National Neuroscience Institute. So I have a lifelong interest in brain health and brain problems.
Have you mentored any students before, like now and before? Have you mentored them?
Yes.
How is it working with those students?
So I mentored many students, most of whom wanted to go to medical school. So some of them come at the age of 15 or 16 when they're still in high school to understand what medicine is about and also to understand what brain health is about. And I'm happy to say that quite a substantial number of them have gone on to medical school, and quite a few already are practicing medical doctors.
And do any of your students have ADD?
Yes. So,
And
yeah, go
yeah,
on,
go ahead, please.
Vedika.
I'll let you
Go
hear it
ahead,
from you.
because you asked whether any of the students had
ADD, and what was your experience
ADD.
with them? And what have they taught you as you were as you were the one who meant as you were like a teacher to them, right? Guru. So,
So,
what did you learn from them?
so the among the students, there are some that definitely have attention deficit disorder,
Yeah.
and that's not surprising. The way I look at attention deficit disorder, it is not a disease. We shouldn't label people as having a problem. I think they are part of what we call neurodiversity in humanity. So among human beings, there are people of all shapes and sizes. As we know, we can physically see
Yeah.
that. Some are tall, some are short, some are good at sports, some are good at studies, and therefore having attention deficits is quite, not very unusual among young people.
But why
However,
is it called?
some are more severe than others. That's true.
Yeah, but like, why is it called disorder then? Because like, if you're saying that it is not a disease or disorder, but why is it mentioned as a disorder?
I mean,
You see, like
yes, I
I
understand that.
believe I believe that 80. Sorry, my mom is in the next room, but I believe that ADD actually is actually like some people have said that it's a gift because like some of them are very smart. Like I had interviewed a person called Mr. Arthur, and he had severe ADD, but he's gone to Cambridge, and he had like completed he had been at Cambridge, and he has studied in, I forgot the other college, but it was like part of it is one of the top colleges in UK. And I was just surprised because all I heard was that many people actually have done bad when they have ADD. Get it
Yes.
right?
So let me be careful in what I'm telling you. In the medical community in general, problems such as ADD, ADHD, autism spectrum are considered as disorders. But there's a reason for that. That is so that we can do more research into these people. But on the big picture, I don't think we should label people as having a specific disease. I think they are part of the diversity of humanity. Of course, some people may have more severe problems than others, and then we need to take more care of those people. So, understanding what is happening with them and getting a diagnosis, I think, is quite important. For the vast majority of people, though, they may have milder forms of the problem, and what we need to do is provide them with the tools so that they can be part of general humanity. And I completely agree that attention deficit problems can also be associated with some gifts. That's that's definitely possible with talents and gifts. Among the students I mentored who come from good schools and some from not so good schools, I would say that at least three of them had some aspect of attention deficit problems, and two of them had obsessive compulsive disorder. But all of them were very bright and intelligent, and they were able to go on to university and perform quite well. I think of the labeling of any problem as one way to arrive at a solution. In other words, there are those who do not know they have a problem. That might not always be the best thing. At the same time, we cannot make it into like a significant disease. This is bad. Something bad is going to happen to you. I disagree with that type of thinking.
And you most students are in most people are innovative, and I what you said was correct, because you can't label them to have a disease and stuff, right? Because, and also I don't get what, like, I understand that you named it as a disorder, but why is it like mentioned in public that it is a disorder? I know,
This is part
because
of how, yeah, Vedika,
sometimes
this is,
it can
yeah,
affect it can affect some people, like it, it it can affect like the way people think, and sometimes it can lead to depression if you label them as a person who has a disease, because like like many cases where they actually do suicide, right? They commit suicide, right? So why do you label it as a disorder? Because some of them might not be happy labeled as to be labeled as a kid with a person with disorder.
well, we label people anyway. We label people as tall, as short, as big or fat. So sometimes there are reasons for labeling people. Sometimes it is mostly, as I said, in the medical side, it is a way in order for us to do research. So once we understand what group you fall into, maybe a better term maybe, what group are you in? So the grouping right now is neurodiverse or neurotypical. I think you may have heard of these terms.
Yeah.
So 15% of humanity is neurodiverse. That's a lot of people. I mean, take any group of people, take 100 people, all right?
Hmm.
15 of them will be labeled as neurodiverse. What do we mean by neurodiverse? They don't think like everyone else. Does that mean it's wrong? No, of course not. In the neurodiverse group includes people with attention deficit problems, hyperactivity problems, um, speech problems, the inability to say things properly is called dyslexia. Some of them have a problem with calculation. It's called dyscalculia. Some people are in the autism spectrum. That means they don't know how to communicate with others. Some people have hypersensitivity or undersensitivity to any kind of stimulation, whether it's touch or sound or light. So, and uh, some people have obsessive compulsive disorder. That means they feel they have to do something many times over, and many of them are perfectionists. But all of these, although we label it currently as a disorder, I feel that is not completely correct. I think these are just variations of human behavior and variations of humanity. It doesn't mean that this is something that you are fixed with. It's certainly something that you can work on. So it's like all human beings have strengths and weaknesses. So if you know your strengths and you know your weaknesses, you need to label it, right? Once you
Yeah,
label it, then you can have a way in which you can deal with it. Does that make sense to you, Vedika?
it does make sense. It seriously does make sense what you said, like about how, about neurodiversity. You were talking about neurodiversity, right? So we it's just that they think differently, like they think out of the box, but they're not, but it's not a disease, they're not but what they have is not a disease or disorder. That's what you're trying to say, right?
That's right. That is
And
my view of things as a neuroscientist, and in I'm an advisor to many groups researching neurodiversity, including ADD and ADHD and others. And that is the philosophy on which we work on. So we're gathering a lot of information, and the whole purpose is to help people realize their full brain potential.
I just want to ask you a question, like not from your field, but do you think that gender issues, like I'm just like very curious, and I know it might not be somewhat related to this, but like to related to what what you're specializing in, but um do you think gender issues can be related to this? Like you mean like ADD, can they be somehow related to each other? Like like ADD, autism, and etc.
So if you look at neurodiverse people, there are some commonalities, there's some overlap between ADD, because ADHD is also one group which includes ADD and autism spectrum disorders and OCD. So, and dyscalculia and dyslexia, there's actually a spectrum, and people have a little bit of each. We've seen that. Uh, However, some of the interesting things is that there's some genetic reasons why in humanity some of us are neurodiverse and some of us are neurotypical. And there are also developmental issues. That means as the brain matures and grows, there are some factors that affect different parts of the brain growing differently and reaching maybe not their full potential immediately. And that may show when you go to a normal school and mix with neurotypical people. And that's where this grouping or labeling uh, takes place. So as I said, we'll use the words grouping and labeling and not disease or disorder, because I think that those are old-fashioned terms. As neuroscience progresses, we'll be better able to understand attention deficit disorder. We already know that part of the reason also is a change in the brain chemicals. I think you know about this, right? Among the brain chemicals that may be affected is something called norepinephrine. Another one is called dopamine. So we know, therefore, that if these brain chemicals are inadequate, of course, there are certain things that you can do to boost these brain chemicals.
And have you encountered have you ever encountered a person with gender identity issues? I know it's not related to what your field or something, but I'm just curious to know because what I believe is that even though they might not be similar to each other, because like I even though they might not be similar to each other, somehow I think like people with gender identity issues are actually are neurodiverse. Do you agree with me? Do you agree that people who have gender identity issues are neurodiverse or not?
Yeah, so everything comes from the brain. How you think about yourself, how you identify as to who you are comes from your brain. So gender identity issues also starts from the brain. The brain actually has three components. One we call the thinking brain, which is cognition. The second is the emotional and behavioral part of the brain. And the third is the part of the brain that moves your body, senses your body. So in the emotional and behavioral part of the brain, there can be changes that make you identify with one gender or the other, or with a neutral gender as is happening right now. I think this has always been present throughout human society, but it's only recently that people are recognizing it. So it is part of humanity and part of neurodiversity in humanity.
But actually, sometimes it is kind of overused a lot. I'm not saying it like to offend people, but sometimes, like I've seen in many cases where, like in the U.S. for example, most of them only focus on the LGBTQIA plus, right? They
Yeah.
mostly focus on that and do not teach children and do not focus on educating children on other aspects other than like they only teach them about LGBTQIA plus. And and compared to Asia, I think Asia, right? In like to consider Japan, China, all of them focus on academics, but they have a wide knowledge on what LGBTQIA plus, and they're aware. But what they're doing in America is extreme, right? Like there are drag queens now being there in school now and educating them. And there was actually a there's actually a clip where a drag queen was actually twerking in front of like toddlers. So do you say that like in the Asian subcontinent, do you think we're more educated, like we're educated like about in math and LGBTQIA plus, and we're not being so extreme into LGBTQIA plus? What is your opinion?
This is a cultural phenomenon. So I think there are certainly aspects in Asia which recognizes gender diversity. It's been there historically for many years, or centuries, in many of the big Asian countries and ancient Asian civilizations. There's less of a value judgment on these groups that there is in the West. Part of that is religious and cultural. I can't comment more on that because I'm not an expert in this area, but certainly it is not a medical problem in that sense as how people behave, because that is something they choose to do.
So do you also say that it's because of it's also because of the way they're influenced? Can you say that?
It's certainly possible. So it depends on your upbringing as a child and also later as an adolescent and in young adulthood. So there can be a lot of influence as to how you think you should behave.
And um you obviously know that I have ADD, right? This and um and I actually sometimes like I believe that I'm goofy, and I feel like sometimes I'm different from others, right? So do you think uh so I don't know how, so like I have ADD, and I feel I'm sometimes different from the others because sometimes I believe that I am not I'm not normal compared to other girls because of the way I am, because I believe that most girls are mature than me, and I just feel um like I just feel like a middle schooler sometimes, like who is very goofy and playful. So what are your thoughts on that? And because like I have ADD, and do you think that age is somehow, do you think my the do you think ADD has a role in has played a part in my age too?
Yeah. So first thing I'd like to say, Vedika, you're a very beautiful and smart girl, and I don't see you as being any different from girls of your peer group. That means those who are in the same class as you.
Hmm.
Cool. All girls who are in the teens have many kinds of insecurities. Sometimes they do not express it. So as you know, we can't read other people's minds, right? We
Hmm.
only see how they behave externally and what they say, but what they may be feeling inside, you really may not know. So whatever you've expressed to me is pretty normal for girls of your age group.
But
So,
sometimes I just like, because most of the girls I believe are mature, and they behave in a different way, and sometimes I believe that I'm an outcast a bit
so I
because
don't,
I'm not.
I think that is quite a common feeling when you're in school, particularly once you get into the teen years. There are those that are the popular students in class. Everyone wants to be like them, and those who feel they are not the same. It's a very common feeling worldwide among teenagers. So what you're expressing to me is quite typical of teenage thought and behavior. There's nothing unusual about it. It's not related directly to you being labeled as ADD.